like the ankle and foot muscles because they are easily organized into groups that make sense. So hopefully that helps. And their innervation is easy as well. So everything from the knee down is innervated by branches of the sciatic nerve. So that makes it really easy, and we'll go through them. So the learning objectives, as usual, are to identify the primary muscles, the prime movers that are responsible for moving the ankle and foot, their origin, insertion, action, and innervation. We are just going to talk about the extrinsic muscles, not the intrinsic muscles of the foot. So you will not be responsible for that information on the intrinsic muscles of the foot. We'll just briefly mention them. You should be able to identify relationships of muscles to each other using anatomical terms, identify positions of active or passive insufficiency for any multi-joint muscle, and identify muscles that pass inferior to the medial and lateral malleoli. Easy, right? So intrinsic muscles are ones that have both proximal and distal attachments within the foot. That goes for the hand as well. We have intrinsic and extrinsic muscles for the hand and for the foot. Extrinsic muscles have proximal attachments within the lower leg or distal femur and distal attachments within the foot. So good examples of extrinsic muscles are like the gastroc soleus, the tibialis anterior. So they have proximal attachments in the lower leg and distal attachments in the foot. The muscles of the ankle and foot provide static control, dynamic thrust in walking, and shock absorption to the distal lower extremity. And they provide some active arch support for that shock absorption. The innervation is pretty easy. The extrinsic muscles of the foot and ankle, the foot and ankle are arranged into anterior, lateral, and posterior compartments. Isn't that nifty? Each compartment is innervated by a branch of the sciatic nerve, either the tibial branch or the common fibular branch. The common fibular branch splits into the deep and the superficial fibular. You will also hear it called the peroneal nerve, which is the old name for it, but you still hear it a lot in the clinic. So fibular and peroneal are the same. All branches of the sciatic nerve. Once the tibial nerve hits the foot, the common fibular, the tibial nerve continues all the way down through the lower leg into the foot. And then there's some branches in the foot. The common fibular nerve goes laterally, wraps around the fibular head, and splits into superficial fibular and deep fibular. And you could probably guess what is innervated by each thing just based on the name. The tibial nerve, once it goes into the foot, it bifurcates into medial and lateral plantar nerves, and they innervate all the muscles of the foot except the extensor digitorum brevis, which is innervated by the deep branch of the fibular nerve. Who knows why? Nobody. Okay. So I love how the ankle and foot muscles divide into these neat little groups. So the anterior compartment muscles include the tibialis anterior, extensor digitorum longus, extensor hallucis longus, and the fibularis tertius. They originate on the anterior and lateral aspects of the proximal tibia and adjacent fibula and the interosseous membrane between the tibia and fibula. All four muscles are innervated by the deep fibular nerve, and they all perform dorsiflexion as one of their primary actions. Doesn't that make it lovely and easy? What could be better, right? So here are anterior compartment muscles. In your lab manual are listed the specific origins and insertions of each one, and you can practice those when you're in the lab. So the lateral compartment consists of the fibularis longus and the fibularis brevis, also sometimes called the peroneus longus and peroneus brevis. Both of these muscles wrap around the lateral malleolus and attach on the foot. So the longus is attached at the lateral condyle of the tibia. the head and the proximal 2/3 of the lateral surface of the fibula. So these are our big everters. The wrapping around the lateral malleolus gives them a line of pull for plantar flexion because it moves it back posterior to the medial lateral axis. So it gives us that line of pull for plantar flexion. The distal attachment is on the lateral surface of the medial cuneiform and the base of the first metatarsal. So it actually dives down underneath the foot and attaches to the base of the first metatarsal. The tibialis anterior goes down the anterior part of the ankle and goes down the medial side of the foot and attaches to the same place. So the fibularis longus and the tibialis anterior form what's called the stirrup of the foot, where they help actively support the arch. Pretty neat, right? So the fibularis longus does eversion and plantar flexion. The fibularis brevis, it just has a slightly inferior attachment. The lateral, the distal 2/3 and lateral surface of the fibula, and its distal attachment is the styloid process of the 5th metatarsal. So where the longus goes under the foot and attaches to the first metatarsal, the brevis is a little shorter, that's brevis, and it attaches to the 5th metatarsal. So it has a strong line of pull for eversion, and going around the posterior side of the lateral malleolus gives it that line of pull for plantar flexion as well. And they're both innervated by the fibular nerve. So the posterior compartment muscles, there's a superficial group and a deep group. The superficial group consists of the gastrocnemius, the soleus, and the plantaris. All of the muscles are innervated by the tibial nerve. They all do a combination of plantar flexion and inversion as part of supination. So they're, similar function, similar action. The main difference between the gastroc and the soleus, the gastroc is a 2-joint muscle. It crosses the knee and the ankle, and the soleus just crosses the ankle. So it's a 1-joint muscle. The deep posterior compartment group consists of the tibialis posterior, the flexor digitorum longus, and the flexor hallucis longus. Some people give these muscles the nickname of Tom, tibialis posterior, Dick, digitorum longus, and Harry. Tom, Dick, and Harry are their nicknames. They go around the medial malleolus. So the fibularis longus and brevis go around the lateral malleolus. The tibialis posterior, flexor digitorum longus, and flexor hallucis longus go around the medial malleolus. And that gives them a line of pull for plantar flexion. Because they go medially, they have the line of pull for inversion and supination. So and they're innervated by the tibial nerve as well. So the posterior compartment muscles are all innervated by the tibial nerve. The intrinsic foot muscles originate and insert within the foot, so they don't cross the ankle. And they're largely responsible for the actions of toes. So if you're doing like towel scrunchies with the toes, you're working on the intrinsic muscles of the foot. As a group, the muscles stabilize the foot, and mostly during the push-off phase of walking or running. So they're little muscles, and they have that strong action on the toes. I don't expect you to know either their names or their origins and insertions, just that they exist.